Good afternoon, everyone. I am Ann Wong with the Illinois Chapter, American Academy of Pediatrics, and I thank you for joining us for today's webinar, VFC Program Changes for CHIP Vaccines. Today we are joined by the Illinois Department of Public Health, the Illinois Department of Healthcare and Family Services, and the Chicago Department of Public Health. We will discuss the changes to the Child Health Insurance Program, CHIP, as it relates to the VFC program. These changes are going into effect on October 1st of 2016. Before we begin, I would like to go over a few housekeeping items. Participant phone lines are muted. This webinar is being recorded. If you have any questions for our speakers during the presentation, please enter them into the question box on your control panel for the webinar on the right-hand side of your screen, and we will answer them at the end after all three presenters have spoken. When you are writing your question, please specify whether it is directed towards IDPH, HSF, or CDPH. Everyone will receive a copy of the PowerPoint slides in PDF format, as well as a link to view the recorded webinar after the webinar has ended. Our speakers today will be Linda Kasbeyer from the Illinois Department of Public Health, Kathy Bertolino from Healthcare and Family Services, and Marcia Levin from the Chicago Department of Public Health. Please join me now in welcoming Linda Kasbeyer from IDPH.
Okay, I just want to make sure that, can you see my screen? Okay, this is Linda Kasbeyer. I'm with the Illinois Department of Public Health. I am the vaccines.
Sorry, Linda, we cannot see your PowerPoint presentation. It is not showing up currently. Oh, there we go. We can see it now.
Can you see it?
Yeah.
Okay. Okay. So this is the mission of the Illinois Department of Public Health, and here is an overview of IDPH. So the purpose of this presentation, it is a collaborative response from the Chicago Department of Public Health, the Department of Healthcare and Family Services, or HFS, and the Illinois Department of Public Health. The purpose of the webinar is to review the Vaccines for Children, or VFC, program changes to CHIP memo that's dated August 22nd, 2016. We'll have a presentation on CHIP reimbursement and MEDI, and then review the next steps. Effective October 1st, 2016, the Illinois and Chicago VFC programs will no longer provide vaccines to providers for administration to children with CHIP, the state's Child Health Insurance Program. HFS refers to this as Title 21 or state-funded insurance. Children through the age of 18 until the date of their 19th birthday who have traditional Medicaid coverage are still VFC eligible.
Our slides are not changing or advancing. We only see the first title page. There we go.
Okay.
Awesome. Thank you.
So children through the age of 18 until the date of their 19th birthday who have traditional Medicaid coverage are still VFC eligible. The HFS refers to this as Title 19. So this change only affects providers who are currently enrolled in the VFC program. If you're not enrolled as a VFC provider, this change is not applicable. So the CDC recommended that the VFC program discontinue the purchase and providing vaccines to VFC providers to administration to children with CHIP. This decision was made by the Director of IDPH and the Director of HFS after months of discussion. The CDC does not require VFC programs to provide vaccines for children with CHIP. The federal vaccine year starts October 1st, 2016, and the change must start at the beginning of the federal vaccine year. So neither the VFC program nor VFC eligibility has changed. The only change is for CHIP patients. We will no longer supply vaccines through the VFC program, and providers will need to seek reimbursement from HFS. CHIP is the state's Children's Health Insurance Program. HFS refers to this as either Title 21 or state-funded. The CHIP program provides health insurance to children and families with incomes that are above Medicaid eligibility but without access to private insurance. Children with CHIP are not VFC eligible because they are insured just as children with private insurance. A child will not have both Medicaid and CHIP on one date of service. They'll have either one or the other. Screening. All VFC providers are required to screen children for VFC eligibility at each immunization encounter. This is a partial screenshot of the VFC patient eligibility screening record that is available in iCare. VFC providers may use either this paper form or a similar paper-based or electronic form as long as it captures all of the same reporting elements. Providers should be sure to mark Medicaid and CHIP separately on the form as they are separate programs. HFS requires providers to check the eligibility status in Medi before administering vaccines or other services, or they risk non-payment. Representatives from HFS will be discussing how to check eligibility status in Medi later in this webinar. Here's a chart showing the different eligibility types through HFS and what vaccines should be used. So the first line for patients with traditional Medicaid or Title 19 who are through the age of 18 until the date of their 19th birthday are VFC eligible. VFC vaccines should be administered, and providers should bill HFS or the managed care organization for the administration fee only. Medicaid or Title 19 patients who are 19 years of age and older are not VFC eligible. Privately purchased vaccines must be administered, and bill HFS or the managed care organization for the vaccines and administration. Patients with CHIP, either Title 21 or state-funded, may not receive VFC vaccines after October 1st, 2016. Providers should administer their privately purchased vaccines and bill HFS or the managed care organization for the vaccines and administration. Other notes on eligibility. Any patient who is 19 years of age and older is not eligible for VFC vaccines. If the patient is 18 years of age or younger and they have private insurance that covers all vaccines, the patient is fully insured and again not VFC eligible. If the patient is 18 years of age and younger and the private insurance does not cover vaccines, or they do not cover all ACIP recommended vaccines, the patient is considered underinsured and they are VFC eligible for the vaccines not covered by the insurance. The patient would need to go to a VFC enrolled federally qualified health center, rural health clinic, or a local health department that's been deputized by a federally qualified health center. The VFC eligibility decision tree and the screening form both will be updated and distributed soon. So we will have a frequently asked questions document posted, but wanted to go ahead and cover some of the questions now. How can we run a report in iCare to show the number of CHIP children we have served? If your clinic has been using the VFC status of V06 VFC eligible S-CHIP plan for your CHIP patients, your 2016 enrollment forms patient population section will show the number of CHIP children you have entered in iCare. There is a change to those codes. CDC is removing the V06 code, and providers will need to start documenting the CHIP eligibility as V22. So here is an example of the VFC enrollment form in iCare showing a sample clinic's number of CHIP children. These are patient records that were either entered or transmitted to iCare with the patient's VFC eligibility listed as the V06 S-CHIP plan. Another question, if a provider is not able to purchase and has not received privately purchased vaccines for CHIP children by October 1st, 2016, can they use VFC vaccines and repay VFC later? No. The Illinois and VFC programs do not allow the borrowing of VFC vaccines. Providers should ensure they have adequate supplies of privately purchased vaccines or reschedule their patients. If VFC vaccines are administered inappropriately on any patient not VFC eligible, the provider will be required to replace the misused VFC vaccines with privately purchased. So it is very important that providers screen the child for VFC eligibility before administering the vaccines. Another question, if a VFC provider administers privately purchased vaccines on a child that they believe had CHIP coverage, but they find out later through billing that the child has Medicaid, can the provider replace the vaccines with VFC vaccines? No. The Illinois and VFC programs do not allow the borrowing of VFC vaccines to replace privately purchased stock used inappropriately on insured children, which will include the CHIPS children after October 1st, 2016. Question, are VFC providers required to service CHIP patients? No, they're not. The VFC program does not require any VFC enrolled provider to serve the fully insured patients, which would include CHIP. We do strongly encourage providers to consider having a supply of privately purchased vaccines for these populations so children can be appropriately immunized. If you do plan to continue to serve children with All Kids Insurance or CHIP, you'll need to have privately purchased vaccines in stock, as you'll no longer be able to use VFC vaccines on or after October 1st, 2016. If a VFC provider decides to no longer accept patients with CHIP, where can they refer these patients? The Department of Health Care Family Services does have information on finding a provider for children at the website listed on your screen. And here's the contact information for both the Illinois and Chicago VFC programs if you have any additional questions after the webinar is over. Okay, thank you.
Okay, thank you, Linda. So we are now going to switch to the Bertolino.
Effective October 1st, 2016, VFC vaccines are limited to Title 19 children up through age 18. All of the participants must receive their vaccines through the provider's private stock. This is for children that are state-funded or Title 21 and for adults ages 19 and up. Please be aware that children who have All Kids can either be Title 19, Title 21, or state-funded. VFC stock can still be used for an All Kids child as long as they are Title 19. On our website, under the Non-Institutional Providers Resources, we will be posting the frequently asked questions, the VFC webinar, Medi instructions, private stock vaccine rates, and vaccine billing instructions. Right now, at this time, you can already find some previously conducted webinars, timely filing instructions, timely filing questions and answers, along with participant liability and participant co-pays. We have provided this link for you. We've also provided a link to the HFS Medical Providers homepage for your use. Providers need to verify eligibility prior to services being rendered. Do not do a date range when checking eligibility. You should only check for the date that services will be rendered. You will need to verify if the participant is Title 19 or Title 21 or state funded. And there are only two ways to verify this when checking eligibility. You may verify this information by either using Medi or the 270-271 eligibility. If you use the automated voice response system, you will not receive the title information for that participant. This includes the phone system and hotline representatives. So if you are not registered in Medi, you really need to get registered because you will only have two options to verify the title information. On these next few slides, we have examples of how to read eligibility when using the Medi system. Again, when checking eligibility, you should only check for the date that services will be rendered. You should not do a date range, as that can give you incorrect information. An example would be if you're checking for a participant's eligibility for the entire month and the patient was eligible on the first part of the month, but the second half they are not, it could show you that they were eligible for the whole month when actually they are not. So make sure you only check for that specific date that you're rendering the services. On this slide, we show you that on data service 5.1 of 16, the participant has all kids, and this is under the case type. We show the services that are covered for this participant. We got examples that show you therapy, medical care, diagnostic, podiatry, etc. Under special information, we show that this is a Title 19 plan. We also show you that they're in a managed care organization, and we also give you the name of that plan along with their contact information. Since this participant is a Title 19 participant, you would use the VFC stock for vaccinations. In this example, though, you would need to bill this to your MCO for reimbursement. This next example shows the data service of 6.1 of 16. They're in all kids, premium level 2. We show you the services that are covered for this participant along with their co-pays for each service. Under special information, we show you that this is a state-funded plan. Providers would need to use their private stock for vaccinations. I would also like to point out that this participant also has a primary insurance. This is where you would see that information at. And under the source code there, this is where we give you the 3-digit TPL code that you would use for billing the department. This example shows a date span of 4/30 through 5/1 of 16. For the data service 4/30 of 16, the case type shows them as being all kids premium level 1. And under the special information is a Title 21 plan. For data service 5/1 of 16, the case type is all kids, Medicaid, and is a Title 19 plan. So if the vaccine was administered on 4/30 of 16, then this would come out of the provider's private stock. If the vaccine was administered on 5/1/16, then you would use VFC stock. This is an example of two different case types for the same date of service. For data service 7/20 of 16, we show this case type is all kids Medicaid. And again, we show you services that are covered, and it's also a Title 19 plan. We also show you another case type, which is DHS Social Services. And Under the special information, we show you this is also state funded. But DHS Social Services does not cover medical services. But since this participant is Medicaid eligible under Title 19, you would use VFC stock for vaccinations. So you're only going to look at the Medicaid eligible, not the DHS Social Services. This is just an example of a participant that only has DHS Social Services. When checking eligibility, if the only eligibility that the participant has is DHS, then the participant does not have medical coverage. As you can see, it states that in the client eligibility that limited medical benefits. This eligibility does not cover vaccines or any other medical services through HFS. On the example that we had just before this, though, we show the participant had both medical and DHS. So the one before the patient was eligible for medical services. And the only reason we're showing you this example here is because you will see this at times when the patient only has DHS. They are not covered for medical. So when checking eligibility, if this is all you see, then the participant is not eligible for medical coverage by HFS, but you will need to investigate if the participant has other insurance from another source, but you will not be able to reimburse HFS for the services that were rendered. Providers who utilize a vendor for eligibility should contact their vendor to determine how title information will be displayed. And vendors can refer to the 270-271 companion guide for this. Vaccines are free to providers from VFC stock, and this is for Title 19 children from birth to age 18. You will need to bill the department for the vaccine that was administered. You will only be reimbursed for the administration fee for administering the vaccine. For these rates, refer to the practitioner fee schedule under the unit price column. Encounter rate clinics should include the vaccine on their claim as a detail code along with their T1015 code. For private stock vaccines, providers will need to use vaccines for the private stock, and this is for children that are 18 and under that are Title 21 or state funded, and also for anyone that is 19 and older. You need to bill the department for the vaccine that was administered. And then for the rates, please refer to the practitioner fee schedule, but this time it will be under the state max column. These rates will also be included under the frequently asked questions and answers. As soon as we get them, they will be posted. For an encounter rate clinic, you will also include your vaccines along with, as a detail code, along with your T1015 code. The department right now is currently working on the rates, and these rates will be posted on the practitioner fee schedule, and the new fee schedule will be coming out soon. Prior to that, though, the rates will be included on our website on the non-institutional providers page, and they will be under both vaccines and also on the frequently asked questions. And we're currently working as quick as possible to get these rates posted, so please keep checking on our websites for these rates. To give you a little example here of what you would see if you're looking on the fee schedule. If you had a procedure code 90647, if it was a VFC stock, unit price, you would check and you would get $6.40. State max if it was private stock, and right now that is to be determined once we determine the rate. For encounter rate clinics, though, for reimbursement, you will only be reimbursed for your encounter rate. So clinics using private stock for vaccinations should bill the same way as they would if using VFC stock. They will need to include all their vaccinations administered as detail codes along with their T1015 code. So you're going to bill private stock, VFC stock, all together along with their T1015 code. For participants that are enrolled in an MCO, providers will need to contact the managed care organization regarding billing issues. As for the reimbursement rate, you will need to contact the plan regarding that reimbursement. The department is almost always the payer of last resort. One of the reasons that you can bill the department directly when there is a commercial insurance primary is when it is for preventative services. You can bill the department directly instead of billing the primary insurance first. When a participant has a commercial insurance as primary and is Title 21 or state funded, you need to use private stock. When a participant has a commercial insurance as primary and is Title 19, you can either choose whether to bill that primary insurance by using your private stock or use VFC stock and bill the department for the administration of that vaccine. So that is the provider's choice that you need to make. Either private stock, bill the primary insurance, VFC stock, and bill the department. But you need to be aware, if you do choose to bill the primary insurance and they reject your claim or even apply everything to deductible, you can still bill the department, but you're only going to be reimbursed for the administration of that vaccine now. Per the American Recovery and Reinvestment Act, claims must be paid within 30 days of receipt. And this wraps up the presentation from HFS.
Okay, thank you, Kathy. We're now going to move on to Marcia Levin from the Chicago Department of Public Health.
Annie, can you see my slides?
I cannot currently see your slides.
Oh, there you go. How's that?
Yep, I can see them now.
Great, thank you. All right, good afternoon, everybody. It's Marcia Levin. We just heard from Linda Casbire at Illinois Department of Public Health and Kathy Bertolino from HFS. And now I know you're all very confused. So what I'd like to do is recap a little bit and maybe hit some of the high points and help with resolving some of your confusion. So the program that we refer to as All Kids, which is CHIP, or Title 21, is a child's health insurance program. So, and we all know that children with insurance, as Linda told us, are not VFC eligible. And we understand that this is a very confusing situation because we've always treated these children, these Title 21 CHIP children, as Medicaid. But beginning October 1st, 2016, these children will not be VFC eligible. Title 21 kids will continue to be served within the HFS realm and will be responsible for the medical care of these children, but not our VFC vaccine. You heard HFS and Kathy refer to the Medi system. And we do want to talk about registration, but we do want to remind you that any person who's going to check the patient eligibility status use the Medi system every time they encounter any type of patient, typically your Medicaid patients. Now in the Medi system there are roles of administrators who should first obtain their own access to Medi and then grant Medi access to other employees once those employees have registered in the Medi system. The administrator may need to review an employee's role to figure out what access in the Medi system a registrar or one of the employees should have. So a person who's just verifying eligibility and does not perform any billing responsibilities just needs to access and verify eligibility in the Medi system. people who are performing billing functions will obviously have a higher level of access. And Kathy reminded us that the automated voice response system, which some of you may have used previous to the requirement to have a computer and a computer lookup, it does not have that special information, Title 19 or Title 21 information in it. So we want very much for you all to have, the access to MEDI. So we've provided the information here. I think Kathy provided it as well. It's here. There is a MEDI registration system help desk at this phone number in option 1 and then 2. We also encourage those people who are MEDI users currently. So for the remainder of September, really pay close attention to that special information section at the bottom of those MEDI screens to clearly see that Title 19 or Title 21 designation for your patients. I think that that will be the most helpful way of you being able to identify who is Medicaid, because the words on the screen say all kids and Medicaid, and as we all know, we've referred to all kids as the Children's Health Insurance Program here in Illinois. So that's why I'm sure people will be confused. But if you just look at the bottom of the MEDI screen in the special information box, you will see pretty plainly whether this child is state-funded, Title 19, or Title 21. If you are currently using an EMR system, an electronic medical record system, we want you to first check your system right now to see if there is a special category of CHIP eligibility as a designation status, if that may be related to VFC designations. This will have to change for you as of October 1st, so that you will have to discuss this change with your vendor. It's important that that gets reviewed right away so that any changes that you need to make will be ready for you beginning on October 1st. We will, of course, there's going to be some issues of how do we define them, and we do think that it's best to spell out CHIP because of the billing related association, but not VFC eligible is a good start for everybody. And please make sure that all of your staff, I know you're all listening in here today, and other people may also need to hear this information as well. But your staff really needs to be educated, and they need to be brought up to speed because this is something that will impact very distinctly on our VFC program throughout the state of Illinois. Linda mentioned for those people who are doing direct data entry into iCare, and we have quite a few people who are doing it, to please note that as of 9/8/16, you will see the special box here that says V22 CHIP, and it will plainly specify the child is not eligible for VFC vaccines beginning October 1st. Now, we do have some time between now and October 1st, and we also encourage all of our VFC providers to get those CHIP kids in before October 1st and get them vaccinated so that we don't have to be turning away kids, especially as we reach the October 15th cutoff for school exclusions. We don't want to have our kids wandering around without vaccines after October 15th, if possible. We also have to remind you that you have to draw down from the appropriate vaccine inventory. If you are doing it in iCare, you have to say private versus VFC, but make sure too that your staff is always aware of from which stock they must take the vaccines that they will administer. It's so important to manage your inventory and make sure that you have appropriate amounts of commercially purchased stock as well as the VFC inventory. You have to keep your private stock separate from your VFC stock, and you have to label all your vaccines private or VFC so that no one is making mistakes or confusing the two supplies as somehow equal, especially when you're paying for the private stock yourself. And we want you to very much maintain an adequate inventory of both to avoid the temptation for borrowing, which is not allowed here in Chicago, nor is it allowed in Illinois. So that's it. I wanted to leave time for everybody to have some questions, and thank you very much.
Okay, thank you everyone for all of your presentations. So I have been getting a couple questions that I noticed in the question panel about whether or not everyone will be receiving the slides. So I just wanted to get that out of the way and reiterate that everyone will be getting a copy of all 3 PowerPoint slides as well as a copy of today's PowerPoint presentation. So I'm going to get started on our question and answer session. There are quite a bit of questions, so if we don't get through to them, if it's okay with Marcia, Kathy, and Linda, I'll send the questions to you guys, and then hopefully we can get those answered later on. So one question that I have is, if a patient has a MCO, do we bill HFS or the MCO for the vaccine and administration?
If they're in a managed care organization, they would bill that MCO.
Okay, and then another question is, when we bill the VFC stock, do we use a modifier to indicate this is a VFC vaccine?
No.
Okay.
No modifier is required.
Awesome. And then another one is, where can patients go to get vaccines if we decide not to provide vaccines? I think that one was directed towards everyone, so if anybody has.
If a client needs a vaccination, they can be referred to at FQHC, RHC, or Department of Public Health, as Linda indicated on her slides.
Okay, thank you, Edna. So another.
Sorry.
Oh.
Can you hear me?
Yes.
Annie?
Yes, I can hear you.
Hi, this is Dr. Doug from Chicago Department of Public Health. Unfortunately, we can't be sure that FQHCs will be able to provide this vaccine, so I don't want to give a blanket statement saying that all those kids should be referred there. And then the Department of Health, we do not have any private vaccine, and so therefore cannot provide vaccine to CHIP children. And unfortunately, that's the situation right now. When we figure out an alternative for where these children can go and network with some of our F2HCs here in Chicago, we may have a better answer.
Yeah. We definitely can't speak for the other local health departments throughout the state because they may be in a similar situation. So the answer to the question is we don't know right now where they can be referred to.
Okay, thank you, ladies. So another question is, what do we do when Medi is down?
Gonna have to wait and check when it comes back up. Hopefully it won't be down long.
Okay, so another question is, does CHIP mean open enrollment? does Medi mean example Meridian Health Insurance?
Can you repeat that question, please?
Yeah, it's does CHIP mean open enrollment? Does Medi mean example Meridian Health Insurance?
Medicaid enrollment.
Medi is not Meridian. Meridian is a managed care organization.
Okay, I'm going to move on.
Medi's our eligibility verification system.
Okay. Hopefully that clears that up for them. And another one is, did I understand that RHCs only get reimbursed an encounter rate? If we give $300 in immunizations, we will get paid $80?
They will only get reimbursed for their encounter rate. And that is for VFC or even if they're using private stock vaccinations.
Okay. And then this question is for HFS. Why are encounter rate clinics not being reimbursed above the encounter rate? This is a disincentive and vaccination rates will surely drop.
We are taking these concerns in consideration, and if there is by chance a change in policy, we will let everybody know.
Okay, and someone wants to know if patients are being notified of these changes.
I think that's an
Not by
HFS.
HFS.
Okay. Another question is, sorry, there are a lot and I'm just trying to filter through them. Okay, so this one's for HFS and it says if someone has an MCO, are they always Title 19?
No, they will need to verify what title they are, but they will need to contact that managed care organization for reimbursement.
Okay, and another one for HFS is, can you please re-explain about VFC eligibility for those who are DHS social services, no medical coverage?
If they only have DHS social services, that does not cover vaccinations. It doesn't cover any medical through the Department of HFS. If they do have medical coverage, as one of the examples I gave, along with DHS, then yes, that would be covered. But if that is all they have, then no.
Okay, and could some all kids patients be in a managed care plan such as Meridian or Molina?
Yes, they can be.
Okay. And another one for HFS again is for patients that just have a case type of social services and they happen to come in for an appointment with vaccines, we would not be able to determine the eligibility. Do we not vaccinate until their eligibility is fixed?
there's nothing wrong with the eligibility if that is all they have, but the provider will need to investigate whether they by chance do have other coverage under a different insurance, a private insurance, but not through HFS.
Okay, and do we have to use private vaccines for all of our under 18 underinsured patients?
If the patient is underinsured, meaning that they have private insurance, but the insurance either doesn't cover vaccines or they don't cover all ACIP recommended vaccines, that child has been and always will be VFC eligible. They can get those vaccines from a federally qualified health center, a rural health clinic, or most of the local health departments are deputized.
And I'll just add to that, this is Marcia, not private providers. So as Linda said, the public providers, federally qualified health department, deputized clinics of some federally qualified health center, but not private providers. They don't serve, they cannot serve underinsured children.
Okay, and another question is, if the patient has only DHS coverage, he doesn't have medical coverage, can he have VFC vaccines as uninsured?
Yes, if they have, fully researched, the only Medicaid coverage they have is that DHS social services. There is no other private insurance. Then that child, as long as he's through age 18, they would be considered uninsured and they can get VFC vaccines.
Okay, and HFS, are we able to bill the patient for the remainder of the vaccine cost if giving private to CHIP?
No, you cannot bill the patient for the remainder of the cost.
Okay, sorry, they're coming in. Really? Okay, so another question is, we are a private clinic where we can send our Title 21 patients. Sorry. John, do you understand my question?
It says we are a private clinic. Where can we send our Title 21 patients, as we will not be administering private vaccines?
We did answer that question a few moments ago by saying we don't know yet where to refer these patients to.
Okay. Okay, if all these patients are being referred to RHC clinics, are we as an RHC required to give our non-patients vaccines?
The VFC program does not require any VFC provider to serve the privately insured, which is what the CHIP patients will be. We don't require you to serve those insured patients. Now, what's required for your actual FQHC or RHC status, I'm not sure if that requires you to serve the privately insured or not, but VFC does not.
Okay, and then if the healthcare center does not have the vaccine and the CHIP patient needs it right away, can the provider prescribe vaccines? Will the pharmacy cover it?
They're not available through the pharmacy.
Okay. And then do we still need to document the CHIP patients to eye care for the vaccine?
if they're able to identify that the child has CHIP insurance, we would strongly recommend that they do put that eligibility in as what will be after tomorrow, V22. It will help the clinic also with next year's enrollment so they can tell for like 1 quarter how many CHIP patients that they're seeing. If they're not able to, they can always put it in as Marsha identified as not VFC eligible, but you will lose that ability to track how many CHIP patients that you're serving.
Okay, and someone wants to know if you can bill a well visit and vaccines for Title 21 kids on the same day.
Yes?
Okay. How and who do we contact for HFS?
Contact for regarding what?
Does not specify. Oh, it says billing questions. So you just said billing questions. So who do they contact for concerning billing?
I can give you our billing telephone number here to talk to one of the consultants, and that is 877-782-5565. That's the number they would call regarding billing.
Okay, so it seems like there are a lot of general questions concerning the overall loss that they will be taking with the vaccines, and people seem to want to comment about that.
And will you be able to forward those comments to us? I think it's important that we do actually read all of the concerns that people have.
Okay, and then another question is, sorry. Are we going to be seeing a lot of kids not being able to go to school? Will the timeline be longer to get a vaccine?
As far as the school requirements, those dates have already been set by each school district and the state. So the parents should have been aware that children need immunizations before the changes for the VFC program providing CHIP vaccines ever occurred. So I think if there's a child who needs immunizations and they're not able to find it, I would certainly recommend that the parent talk to the school district, explain the problem if they're not able to find a provider for their CHIP vaccines, and discuss it with their school district.
And this is Dr. Frashone from CDPH. We are in Chicago trying to reach out to our school nurses so they are aware of the changes and so they can reach out to families if they notice that there are problems.
Okay. Okay, so it looks like we are running out of time now, and unfortunately we do have a lot more questions that are unanswered, but if it's okay with everybody, I'll email those over to you guys, and then we'll try and do our best to answer them that way. I think it'll also be a lot less confusing for everyone. Does that sound good?
Sounds good.
Yes.
Awesome. So thank you.
Annie,
Oh, yes?
Annie, how will the questions and answers be shared?
The ones that you guys answer?
Well, I think in general, all the questions.
So all of these questions that were answered during the webinar, this webinar has been being recorded the entire time. So if people just simply want to go to the questions that were answered, you can go ahead. It's going to be uploaded to YouTube, so you can go ahead and skip towards the last like 20 minutes or so for the question and answer. And if it works out for everyone else, maybe I can compile a list of all of these questions and then send them over to you guys, and in about a week I'll regenerate a list with answered questions and then email them out to all of the participants. In a Word doc.
That's fine. Mm-hmm.
Okay.
And that sounds good.
Yeah. Okay. So awesome. Thanks for everyone for joining. I know that it's kind of a confusing time right now, but thank you for all of your patience, and I'll be sure to get the PowerPoint slides sent over to everyone who participated today, as well as the link to the webinar. Thank you so much.